All right, patient presents with a headache, blurry vision, and bilateral papilledema. What's the diagnosis? Is it normal pressure hydrocephalus or is it idiopathic intracranial hypertension? Well, the answer is choice B. Let's figure out why. All right, so let's start with normal pressure hydrocephalus. The disease is called hydrocephalus because the problem is excess CSF volume accumulating inside of the brain. And this is a slow progressive disease. So these ventricles are going to have time to dilate and compensate for this excess CSF, which means that the ICP is not going to significantly rise. And that's why it's called normal pressure. And how do we know this? Well, the CSF opening pressure on the lumbar puncture is actually how we can measure ICP. And that's going to be normal or only mildly elevated in this condition. The MRI of the brain is going to show those enlarged ventricles that are consistent with hydrocephalus. This is a communicating hydrocephalus, so that all the ventricles are going to be symmetrically enlarged with no signs of obstruction between them. The MRI is also going to show distortion of the white matter around those ventricles caused by the expansions of the ventricles. And the classic presentation here is going to be an older patient, usually above age 60, who's going to present with a triad of cognitive dysfunction, gait problems, and urinary incontinence. And students always remember this as the 3 W's: wacky, wobbly, and wet. All right, so now let's compare this with idiopathic intracranial hypertension. This disease is called intracranial hypertension. That literally means excess intracranial pressure. So that's the problem here. And it's called idiopathic because this increase in ICP is not caused by a brain mass or any other clear explanation. So it's idiopathic. The CSF opening pressure is going to be very high because remember, it's a marker for ICP, which is very high. That's the literal definition of this condition. But unlike NPH, the excess CSF volume is not a problem here. So there's no hydrocephalus. So the MRI of the brain here is going to be normal. There are no tumors and no hydrocephalus. The other name for this disease is Pseudotumor cerebri, and it's called pseudotumor because the disease is not a real tumor. It's a pseudotumor because it acts like it by increasing the ICP. The classic high-yield clinical presentation here is going to be a younger female, usually 20s to 30s, associated with obesity, but some meds can also cause this condition, like vitamin A analogs and tetracycline antibiotics. And then finally, the symptoms here are all going to be caused by the problem, which is high intracranial pressure. So the main symptom is going to be a headache, but can also have blurry vision and tinnitus. And the high-yield clinical exam finding you have to know is bilateral papilledema, which again indicates the high intracranial pressure. All right, so to summarize, in normal pressure hydrocephalus, the CSF volume is increased, but the ICP is normal. In idiopathic intracranial hypertension, those parameters are reversed, so CSF volume is normal, but intracranial pressure is high. The MRI is going to show ventriculomegaly, which is dilated ventricles, in NPH, but it's going to be normal in idiopathic intracranial hypertension. The LP opening pressure is going to be normal in NPH, but elevated in idiopathic intracranial hypertension. And the main clinical symptoms in NPH is going to be an older patient, usually above 60, who's going to present with the 3 W's, whereas in idiopathic intracranial hypertension, it's going to be a younger female with obesity, and symptoms are going to be due to high intracranial pressure, mainly headache and bilateral papilledema.